3 out of 4 menopausal or perimenopausal women are declined any medical help if they ask their healthcare provider. Only 20% of doctors are trained to diagnose and treat menopausal symptoms, despite the study showing that hormone replacement therapy or HRT, the main treatment for menopausal symptoms, can increase life expectancy by up to 15 years. In this video, we shall understand how women in past and present have been failed by medical research by denying them medicine that can be easily prescribed and which will protect them from increased risk of heart attack, dementia, osteoporosis, depression, and diabetes. This health concern has been known since the start of human civilization. Menopause is a natural transition in life of every woman when her periods stop forever. The average age of menopause is 51 years. The ovaries stop producing the hormones estrogen, progesterone, and testosterone. The decrease in the level of these hormones starts as early as 35 years of age. Following the decrease in hormone levels, women start feeling hot flashes, brain fog, lethargy, weight gain, lowered sex drive, lowered motivation, and loss of interest in life. There can be more than 30 symptoms associated with menopause. Most menopausal women find these symptoms debilitating and find their quality of life to be severely compromised. To uncover why the medical system is letting down the women in menopause, we need to rewind to 1991, a pivotal moment in the women's health history. Enter the Women's Health Initiative, or WHI for short, is a series of massive clinical studies run by the National Institute of Health in the United States. Its mission? To address the benefits and downsides of hormone replacement therapy (HRT) in healthy postmenopausal women. Healthy is the word. Over 160,000 women aged 50 to 70 years participated in WHI across 40 different centers in USA. It was a groundbreaking effort aiming to shed light on the critical health issues affecting postmenopausal women on HRT. The participating women were divided into two groups. The first group was those who had the uterus intact. The second group comprised women who had their uterus removed surgically. The estrogen used was conjugated equine estrogen, and this was called by the trade name Premarin. The chemical was derived from urine of pregnant horses, thus the name Premarin. Pregnant mare. The progesterone used was medroxyprogesterone acetate, which is an artificial progesterone. The first group, which had the uterus intact, were given either estrogen and progesterone combined or just a placebo. Progesterone is needed to prevent uterine cancer if one is on estrogen and has got a uterus inside the body. Those who had the uterus removed were given only estrogen. But then, in 2002, a bombshell hit the study. One segment of the HRT trial was